If they spend it, will you buy into it? The Obama administration is reportedly spending $700 million on publicizing and marketing the healthcare law. But when more than half of all people want the law repealed, is spending $700 million a good idea? Fair and balanced? To Ebony Williams, who says yes it is, and Gretchen Hamel, who says no it's not. Ebony, to you first. $700 million to convince us that Obamacare really is good, even though a majority wants to repeal it, and we have to pay for it. You better make a strong case, Ebony. Go.
Sure, Stuart. Well, certainly I would submit that the $700 million is actually designed not to convince us that it's good, but it's to educate people on what Obamacare is. The Supreme Court has spoken. Obamacare is here to stay. And there certainly should be a sound investment so that the 300 million Americans affected by Obamacare will have the knowledge to know how to best utilize it, how to best make it work for them.
Gretchen, $700 million. That seems like an awful lot of money.
It's an awful lot of money, and $700 million seems more like a crisis communications plan than a plan to actually sell the president's health care law. And rightfully so. You just have to look at what's happened already. It's broken its promises. You're not going to be able to keep your plan like they said we would. Your rates are going up. They said your rates wouldn't go up. And the president's key supporters, the unions, came out, 3 of them last week, signing a letter to Democrats saying that this will destroy the health and well-being of the union members and will destroy the 40-hour work week as they know it.
Ebony, I've got to say it sounds a little desperate. An awful lot of money spent right before these exchanges are supposed to open up, when a majority of people say repeal this thing, and Obamacare has never been fundamentally popular with America. Go ahead. I say it looks like desperation.
I don't think it's desperate, Stuart. I think we have history to show that this is commonplace. Nobody said it was desperate when George W. Bush's Health and Human Services Secretary spent $350 million to promote just Section D of their Medicare expansion part. So that's just one section, $350 million, and no one said that was desperate. So I believe the Obama administration is well within their rights to spend what they feel like they need to make sure that the 300 million people who will be affected by this legislation have the knowledge to move forward in a positive way.
Gretchen, Ebony makes a point. A lot of this money is basically educational, not what we think of as conventional advertising. Respond to that.
Well, we're $17 trillion in debt. This bill, the Affordable Health Care Act, wasn't even supposed to cost us $1 trillion. It was actually supposed to help bring down the deficit. And what we're seeing now is that they're saying it's going to cost more. They say it's going to cost $1 trillion, that it's now going to cost us $700 million in marketing. What more is it going to cost? And the American people believe it's going to cost them more in their health care. It already is. So the costs continue to add up, but no one is seeing the benefit, and everyone has high anxiety that this will even work because we've seen the incompetence of government over the course of the past few months.
Gretchen, to you on this one, seems like it's young people who've got to be convinced more than any other. Is it going to work?
Well, this all hinges. The ability for Obamacare to work hinges on young men and young adults signing up, because at the end of the day, they will be the ones who are paying for the health care costs of the senior citizens. It's much like how Social Security works right now. And let's look at Social Security. Let's look at Medicare. Those programs are going insolvent in the next few decades. Why? Because we have fewer younger people working and paying into the system. So how can we build, knowing that this is a system that collapses over time, how can we build another government entitlement program that depends on young people paying for health insurance that they don't even want or even need?
Gretchen, Ebony, it was a good debate, and we appreciate your from both of you. Thank you very much indeed.
Thank you.
Thank you.
Attention.